Mastering NCLEX rationales, step-by-step practice exam answers. Question 1. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? Option A. A history of hepatitis C 5 years previously. Option B. Cholecystitis requiring cholecystectomy 1 year previously. Option C. Asymptomatic diverticulosis. Option D. Crohn's disease in remission. The correct answer is option A. A history of hepatitis C 5 years previously. A history of viral hepatitis C permanently disqualifies an individual from donating blood due to the lifelong risk of transmitting the virus. Question 2. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Option A. Sexual contact with an infected partner. Option B. Contaminated food. Option C. Blood transfusion. Option D. Illegal drug use. The correct answer is option B. Contaminated food. Hepatitis A is transmitted via the fecal-oral route, most commonly through the ingestion of contaminated food or water. Question 3. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following tests assesses coagulation? Option A. Partial thromboplastin time. Option B. Prothrombin time. Option C. Platelet count. Option D. Hemoglobin. Option E. White blood cell count. The correct answers are options A and B and C. Partial thromboplastin time, prothrombin time, platelet count. The liver synthesizes clotting factors. PTT, patient, and platelets all measure the body's ability to clot, which is crucial to assess before a highly vascular liver biopsy. Question 4. A nurse assigned to the emergency department evaluates a patient who underwent a fiber optic colonoscopy 18 hours previously. The patient reports increasing abdominal pain, fever, and chills. Which condition poses the most immediate concern? Option A. Bowel perforation. Option B. Viral gastroenteritis. Option C. Colon cancer. Option D. Diverticulitis. The correct answer is option A. Bowel perforation. Fever, chills, and sudden increasing abdominal pain following an invasive colonoscopy are hallmark signs of peritonitis caused by a bowel perforation. Question 5. A patient with a history of diabetes mellitus is on the second post-operative day following a cholecystectomy. She complains of nausea and is not able to eat solid foods. The nurse finds the patient confused and shaky. What is the most likely explanation? Option A. Anesthesia reaction. Option B. Hyperglycemia. Option C. Hypoglycemia. Option D. Diabetic ketoacidosis. The correct answer is option C. Hypoglycemia. A diabetic patient taking insulin or oral hypoglycemics who is unable to eat will rapidly develop hypoglycemia, which presents with tremors, diaphoresis, and confusion. Question 6. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? Option A. A diet high in grains. Option B. A diet with adequate caloric intake. Option C. A high-protein diet. Option D. A restricted sodium diet. The correct answer is option D. A restricted sodium diet. Addison's disease causes aldosterone deficiency, which leads to massive sodium loss in the urine. Restricting sodium is dangerous and contraindicated. Question 7. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes? Option A. Elevated serum calcium. Option B. A low serum parathyroid hormone. Option C. Elevated serum vitamin D. Option D. Low urine calcium. The correct answer is option A. Elevated serum calcium. The parathyroid glands regulate calcium. Hyperparathyroidism results in excessive hormone release, pulling calcium out of the bones and leading to elevated serum calcium levels. Question 8. A 23-year-old patient in the 27th week of pregnancy has been hospitalized on complete bed rest for 6 days. She experiences sudden shortness of breath, accompanied by chest pain. Which of the following conditions is most likely? Option A, myocardial infarction due to atherosclerosis. Option B, pulmonary embolism due to deep vein thrombosis. Option C, anxiety attack due to worries about baby's health. Option D, congestive heart failure due to overload. The correct answer is option B, pulmonary embolism due to deep vein thrombosis. Pregnancy causes hypercoagulability, and prolonged bed rest causes venous stasis. These combined factors create a massive risk for deep vein thrombosis turning into a pulmonary embolism. Question 9. A patient who has been diagnosed with Raynaud's disease complains of cold and stiffness in the fingers. Which of the following descriptions is most likely to fit the patient? Option A, an adolescent male. Option B, an elderly woman. Option C, a young woman. Option D, an elderly man. The correct answer is option C, a young woman. Raynaud's phenomenon is a vasospastic disorder predominantly affecting the hands and feet, occurring most frequently in young, healthy women. Question 10. A nurse is providing discharge information to a patient with peripheral vascular disease. Which of the following information should be included in the instructions? Option A, walk barefoot whenever possible. Option B, use a heating pad to keep feet warm. Option C, avoid crossing the legs. Option D, use antibacterial ointment on all skin lesions. The correct answer is option C, avoid crossing the legs. Crossing the legs heavily compresses peripheral blood vessels, further compromising already diminished arterial blood flow to the lower extremities. Question 11. Claudication is a well-known effect of peripheral vascular disease. Which of the following facts about claudication is correct? Option A. It results when oxygen demand is greater than oxygen supply. Option B. It is characterized by pain that often occurs during rest. Option C. It is a result of tissue hypoxia. Option D. It is characterized by cramping and weakness. Option E. It only affects the upper body. The correct answers are options A and C and D. It results when oxygen demand is greater than oxygen supply. It is a result of tissue hypoxia. It is characterized by cramping and weakness. Intermittent claudication is an ischemic muscle ache or cramp triggered by exercise due to inadequate arterial oxygen supply and tissue hypoxia. Question 12. A patient in the cardiac unit is concerned about the risk factors associated with atherosclerosis. Which of the following are hereditary risk factors for developing atherosclerosis? Option A, family history of heart disease. Option B, overweight. Option C, smoking. Option D, age. The correct answer is option A, family history of heart disease. While weight and smoking are modifiable risk factors, a direct genetic family history of cardiovascular disease is a non-modifiable, hereditary risk factor. Question 13. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which is the most likely explanation for these symptoms? Option A, inadequate tissue perfusion leading to nerve damage. Option B, fluid overload leading to compression of nerve tissue. Option C, sensation distortion due to psychiatric disturbance. Option D, inflammation of the skin on the hands and feet. The correct answer is option A, inadequate tissue perfusion leading to nerve damage. Chronic lack of arterial blood supply starves peripheral nerves of oxygen, leading to ischemic neuropathy, causing severe burning, tingling, and hyperesthesia. Question 14. An infant with a hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Option A, massaging the groin area twice a day. Option B, referral to a surgeon for repair. Option C, no treatment is necessary, the fluid is reabsorbing normally. Option D, keeping the infant in a flat supine position. The correct answer is option C. No treatment is necessary, the fluid is reabsorbing normally. Most congenital hydroceles are harmless and self-resolve as the fluid slowly reabsorbs over the first year of the infant's life without intervention.